everybody. In today's video, we're going to be talking about these one class of medications that are taking the world by the storm. These are the GLP-1 weight loss medications, which are being dubbed wonder drugs. And in my presentation today, I'm going to be delving into some side effects related to these medications and in specific gut related side effects, and one in particular about which there is growing evidence of concern. And I'll be sharing some scientific data with you, but the whole essence would be to give you some practical takeaways. So please allow me to share my screen with you such that I can make this presentation and give you the information that I have to share. So, what is it that you need to know about GLP-1 medications if this is something that you are considering taking, and what is the relevance when it comes to reflux? Reflux is also dubbed as heartburn or gastroesophageal reflux. A lot of people call it with different names, but essentially it is an excess amount of acid coming into the stomach. Now, by way of introduction, who am I to talk about it? My name is Dr. Arun. I'm a gastrointestinal surgeon, but one of the key areas of my focus is to see how our metabolic health intersects with that of our gut health. So these two things are very interlinked, and it is important for us to understand through education, through evidence, through scientific research about how we can make better evidence-based, well-informed decisions. The one particular study that I will be referring to in this particular video is the one that I'm sharing with you on the screen, which is a meta-analysis. Now, a meta-analysis is not just one study, but it's a compilation of multiple studies. That means it is very strong as far as its evidence is concerned. And this article was published as recently as June in 2025. So it's got very up-to-date information. By way of background, I think it is important to recognize that GLP-1 medications are being used for so many different indications besides just weight loss. The Ozempic, Trulicity, Mounjaro, Wegovys, they've certainly shown benefits in diabetes and obesity management, but also in cardiac health, in renal health, and also now there is studies that are showing that it assists with dementia. So I think these benefits will keep unraveling, unfolding with time as more and more people and more doctors use these medications. But I think what my purpose of today's video is to actually share with you some research around what are the risks that we also need to know about these medications so that we can use them in a safe and an effective manner. Let's firstly understand that what are GLP-1 medications? GLP is called glucagon-like peptide. It's a natural gut hormone which allows us the feeling of satiety. And how it does that is actually it slows the stomach emptying. So when we eat food, it lands in the stomach, and there is the muscle in the stomach which pushes the food down. But when this muscle is slowed down, it is called delayed gastric emptying. And what it leads to is a feeling of fullness, and it reduces your hunger. It also lowers your blood sugar levels, reduces appetite, and has got other benefits related to weight loss. The flip side of this is that when the stomach emptying is slowed down, it actually creates more stasis and more pressure in the stomach. This is what leads to acid buildup, and this acid then starts to come back into the esophagus, which is your food pipe, and that is where it starts to manifest as heartburn, acid reflux, gas pain, dyspepsia. It goes with different names depending on what name you are referring it to. The other serious impact of long-standing reflux is that of a condition called as Barrett's esophagus. Now, Barrett's is a change that happens over a period of time when an individual is having a lot of reflux or a lot of heartburn and regurgitation. And this Barrett's is a precancerous condition. The risk of progression to cancer with Barrett's increases over time and, of course, based on certain other features. So, what did this new study find? And this image actually shares with you the summary of the study. They looked at 55 randomized controlled trials with over 100,000 patients. So that's a pretty good, strong follow-up. And what they found was that the use of these medications is associated with increased risk of developing stones in the gallbladder and also doubling the risk of gastroesophageal reflux disease or heartburn. As far as other conditions are concerned, like pancreatitis or bowel obstruction, they believed that the risk was not as high. And by the way, if anybody is interested in reading more about this study, I have put a link over there as well, which I'll put in the notes too. So, in summary, what it found was that the risk of reflux is doubled. So, people who are not taking GLP-1 medications versus those who are taking. Gallstone risk goes up by about 46%. Other serious gut issues like bowel blockages and other things are not as common. But as I'm sharing with you in this particular image, the real reason for reflux is when there is more fullness in the stomach, the acid does not flow down easily as it would normally, and it tends to regurgitate up through the opening in the valve, which is between the food pipe and the stomach. Why is reflux important? Reflux leads to damage to the esophagus. It first creates inflammation in the esophagus, and this inflammation, if it continues, leads to ulceration and also Barrett's esophagus, as I just mentioned to you, which is also a cancerous condition. But here is what is very important to keep in mind. Reflux can be silent as well, which means you may actually not experience the typical symptoms that I'm just describing, but you may still be getting reflux if you're on these medications. Who are the people who are at a higher risk? Number one, people who are actually experiencing symptoms. They've had these symptoms before starting the GLP-1 medications, and they are now on the medications and their symptoms have become worse. Number two, obesity and individuals more not just obese, but who are carrying a lot of weight around their middle part, which is around their tummy, or as they say, visceral fat. Also, individuals who have got a hiatal hernia. Now, hiatal hernia is basically a laxity of the muscle around the valve, causing a part of the stomach to go up into the chest. And when this happens, the valve, which is there between the food pipe and the stomach, which prevents the reflux, actually cannot function properly. And when that happens to be the case, reflux is a natural side effect that happens on an ongoing basis. Individuals who smoke, drink heavy, or eat late at night, as many of us would be engaging due to social commitments and others, they would be at a higher risk of getting reflux. And of course, people who have got a past family history of Barrett's or esophageal cancer are also prone to do this. What can you do about it? And I think this is where the more important thing is as far as the information you can take from this video. Firstly, if you have got symptoms or concerns, talk to your doctor before starting the medications. Watch out for reflux symptoms. As I said, reflux symptoms can manifest in a variety of ways, but it can also be silent. Simple lifestyle tweaks like cutting out on smoking, taking smaller meals, don't lie down straight away after a meal, and of course, avoiding fatty, cheesy, greasy foods late at night. Medications like proton pump inhibitors or Nexium and Somac can be helpful and protective. However, please understand that long-term consumption of these medications is also associated with side effects as we are beginning to find. And if you're unsure about any of this, get an endoscopy done. An endoscopy is a camera down the throat. It's a very quick day procedure, and it can give you an idea about what is the extent of the damage, whether it is pre-existing or it is due to long-term intake of GLP-1 medications. Should you stop GLP-1 medications? And I think based on the results of the study, you got to weigh the risks and the benefits. I do not believe that you need to stop as a knee-jerk reaction. However, you got to take a balanced approach around it, and based on the symptoms that I've just described to you, if you fall in any of those high risk categories, get yourself checked. What is the bigger picture? I think the bigger picture is that the GLP-1 medications are here to stay. They are powerful, but they are not perfect. And this is where we need to use them cautiously using information and evidence. Also, use proactive gut health related strategies such as taking prebiotic foods, engaging in intermittent fasting, keeping your bowels regular. So, this is where the role of working with your dietitians and allied health team, including your GP, is very essential. So the key takeaways that I can share with you is that the GLP-1 medications are highly effective medications. I believe they are here to stay. More importantly, they have a risk of gastroesophageal reflux and also that of gallstone disease, which I'll cover in a separate video. Reflux is important to know and address in a timely manner due to its progression to Barrett's esophagus. Essential part is educate yourself, raise your awareness, and take action by seeking professional advice and also work in with your team. Now, if you like the topic of weight management combined with gut health, I've written a book which is called Happy Gut Healthy Weight. You're welcome to check it out. And for those of you who don't like reading a book, well, the book is also available on Audible. So stay tuned and do subscribe to this channel, and I will keep you posted about further developments. Take care.